This video highlights advances in surgical visualization and instrumentation that I think is really going to make our job easier as retina specialists. This is a patient with a really fibrotic adherent hyaloid and underlying cystic macula. Here we're using the Ingenuity system with data fusion, and we can see how we can monitor our vacuum in real time and have excellent stereopsis on this kind of tricky peel. And when we get to a sticking point, we'll pulse the cutter. And the cutter is a beveled 10K cutter, which really allows us to generate a PVD precisely and atraumatically. The next case is a diabetic with a lot of preretinal membranes, and here we're seeing how tenacious they are. And we're using the beveled 27 gauge cutter bimanually with a 27 gauge max grip forceps. And the beveled cutters really work as a multifunction instrument, as you can undermine the tissue with a bevel and then pulse with the vitrectomy, and you can see your aspiration and your cut rate in real time, which really gives such control and precision. This is another relatively complicated diabetic. We can see once the vitreous hemorrhage is removed that we see so well with Ingenuity that we can see individual red blood cells going through the vessels. Here, the shark skin forceps are able to allow us to atraumatically remove the internal limiting membrane without stain and underlying floppy vessels. The 27 gauge max grip aren't quite as precise, but do an okay job. Next, we see the value of digital filters in this complex diabetic with dense vitreous hemorrhage and almost no platelets secondary to myelofibrosis syndrome. We're able to adjust the color filters, which allows us to delaminate membranes and achieve a good anatomic result with silicone oil. This is another difficult diabetic, dialysis patient with a chronic detachment and fibrotic blood. Here we're using different color filters along with beveled 10K cutter and the shark skin forceps, and we're finally able to see some retinal detail after some delamination. The shark skin forceps were superior to the max grip forceps in terms of elevating this thick tenacious membrane more precisely and achieving a good surgical result. So the combination of these advances really have permitted us to address surgical challenges better. Thanks.